Fast forward to today, of course, we live in a digital world, technologies have advanced, and the market is heavily saturated with radio services, streaming services, podcasting, on-demand, and social media. And all of these channels are using a multitude of platforms to reach our audiences. Today, almost everyone's got a smartphone in their pocket and can listen to whatever they like. So to me, it's clear that hospital radio needs to become more creative, think outside the box, adapt, and innovate. And of course, we need to remember that with an ageing population, there are still generations that do not have access to smartphones or technology as well. So today, I really want us to focus on how hospital health and wellbeing broadcasting can tap into this and continue to stay relevant whilst meeting your charitable objects. Of course, in the commercial radio sector, radio has evolved with network programmes forming big parts of schedules. But this is where hospital health and wellbeing radio has a really unique opportunity, in my view. We're at the heart of our communities, living and breathing the towns and cities and surrounding areas and people within them. And I'm not wishing to preach to the converted, and obviously conventional hospital radio certainly does still have its place, but with the shifts in healthcare provision, we all need to think about the bigger picture. So mental health and wellbeing is big on the healthcare agenda today, as are health and social care services in the wider community. So we need to think about how we as radio services can work to promote these and forge closer links and relationships with key stakeholders and build trust and rapport within our communities. There's also a greater focus as well on healthcare in the local community, or even in the home environment. So in England, integrated care boards, or health boards in the devolved nations, focusing on planning and developing the health services for their local regions. Of course, the third sector and the voluntary sector has a crucial role to play. I'm sure here in Winchester there are many charities and voluntary organisations, from those providing health and care services or providing essential support to those who need it, to those who deliver physical activity programmes to help us keep healthier and active for longer. Wearing my station hat, one of the things we've picked up on since returning to the wards last year is how hospital radio has a positive impact not only on the patients but also on hospital staff. We're increasingly finding that we're there for the staff as well, and our ward volunteers have become a familiar sight on our wards and love chatting to the staff, and the staff love chatting to our volunteers and giving them their requests. And we're finding that this is helping to boost staff morale in our hospital, helping to improve their well-being. Of course, patients are generally transient in and out of hospital, but the staff are consistent and there all the time. So we're finding that that's a shift in the last few years. Initiatives as well like social prescribing are becoming more prevalent. Social prescribing is an approach, of course, that connects people to activities, groups and services in their communities to meet the practical, social and emotional needs that affect their health and well-being. And of course, housing, income, employment and environment have all got a profound impact on our health and well-being. So we need to consider just how hospital health and well-being radio services can adapt around the whole health and social care ecosystem. Much research has been done around the impact of what we do as well. And the UK Community Radio Network and the University of Northampton recently published their Ofcom community radio funded research, Listening Locally Across the UK, which was a study into the nationwide listenership and impact of local community radio. Surveying a sample of nearly 6,000 people, its findings were published a month ago, and the report also cited HBA's own impact report. And I just want to share a couple of quick statistics from that research paper, if I may, as I think these are particularly poignant to note. So information about health and health services heard on community radio was trusted and acted upon, with 85% aware of services being played out, 76% agreeing it helped them personally, 74% more likely to help in local communities than elsewhere, with 74% saying they were more likely to act upon it. Most crucially, 71% their health had improved as a direct result of hearing about health services on their local community radio station. This makes for very strong evidence for the positive impact of local community radio on the health of listeners. And when asked whether listening to local community radio helped them feel calmer, the responses overwhelmingly suggested it did. Crucially, listening to community radio meant people felt they could actively seek help, with 41% agreeing that listening to their local radio station has helped them feel they can seek help. 15% strongly agreed, with 10% disagreeing, and 3% strongly disagreeing, which means overall 51% of respondents felt that local radio helped them feel calmer, with 56% feeling that it actually helped them seek help. We will actually share this report with our members if we haven't done so already, as it does make for very interesting reading. So many of you, of course, our member organisations that are in the room today have already begun that evolution, looking at new innovative technologies and ideas to reach your audiences, and of course later on today we'll be hearing about some of those opportunities. But there's more. So these sessions are not just about sitting back, listening to what we've got to say this morning and absorbing the information. We want to spark conversation and ignite debate, and we really want you to be part of the conversation. So as Nigel has said, all of our free sessions today will be followed by panel sessions. That's going to be after our refreshment break this morning, the first one. And hopefully we can have some lively debates and discussions on the future of hospital health and wellbeing broadcasting in our modern day NHS. Broadcasting beyond the bedside, of course, later today and creating compelling content. So I hope you've got some questions lined up for our speakers. So now I've gone through all of those things, without any further ado, let's kickstart our first part of this session. We'll shortly be hearing from our two keynote speakers this morning, and I'm excited to hear their views as to how hospital health and wellbeing broadcasting can adapt within the evolving NHS. But first, I'm going to hand over to those of our member station representatives who are presenting our 90-second showcases. These, as I say, are a collection of 90-second presentations or statements from members from across various parts of the country, serving to illustrate their adaptation to evolving circumstances or shedding light on specific challenges they've encountered. So I think we've got the first one, Nigel, which is a video.
If you click the thing, if you click on one more, it should start playing.
With the award of an Ofcom licence in 2014, CHBN has evolved from being Cornwall Hospital Broadcasting Network into the Community and Hospital Broadcasting Network. During 2020, CHBN faced much the same challenge as any other hospital radio station around the country and indeed around the world. Our studios were within the hospital and neither infection control nor voluntary services wanted us there. A few of our presenters had home studios, but as a community radio station we could not survive for any length of time on pre-recorded or voice-tracked programmes. So we used Icecast and Clean Feed and soon had the resources to get more than 20 of our presenters on air live from home. This was a very satisfying achievement as the essential information we were providing to the hospital and the wider community was highly appreciated. During the pandemic, we started a 5 days a week community help show, and out of that has grown a new weekly programme aimed directly at hospital staff and patients. Called the RCHT Show, it's produced by the hospital's highly professional communications team, so it is, of course, both authoritative and slick. We're very proud of the way the station has evolved and met the challenges of the changing times. But the challenges continue, so it's an ongoing process of evolution. And as our Ofcom licence has recently been renewed for another 5 years, CHBN is definitely in it for the long haul.
Just leave. Mark.
We have Mark Oldfield.
Good morning. I'm Mark Oldfield, Chair of Harrogate Hospital Radio. In 2018, I was notified by the Trust that Hospedia was going to be taken out. And fortunately, we'd actually made steps to go online prior to this. So I first applied to Ofcom in 2018 for an FM licence because not all people have access to a smartphone or a tablet, and I felt that this was actually missing within the hospital. We were very lucky. Out of the blue, I got a phone call from Ofcom inviting us to take part in the trial of the LPRL, which we started in 2020. And on the 21st of September 2021, Andrew Jones, our local MP, was invited to the studios to switch on our transmitter. We started with 100 milliwatts. After the first report that I did to Ofcom, they upped it to 500 milliwatts because of areas like radiography. You weren't getting reception down there. And on the third report that I'd actually done, Ofcom very kindly increased it to 1,000 milliwatts. So a team of us did a recce around Harrogate, and we actually broadcast in a radius of 20 kilometres around the hospital, which is incredible for a hospital radio station. I did a deal with ASDA to buy 100 FM radios so that we could supply these to patients who don't, again, have access to smartphones or tablets, so that they can borrow an FM radio whilst they're in hospital. We've had incredible support from the Trust at Harrogate. We've worked closely with HHCC, which is Harrogate Hospital Community Charity. We work with them, we promote everything that they're doing. We have concrete evidence that our listeners have increased threefold. That's evidenced by emails that are coming into the studios, people call into the studios, but we never lose the focus that we are a hospital radio station. more applications from prospective members, and also more interaction with the hospital. So actual departments within the hospital are coming to us to ask if they could promote things that are going on within the hospital. We were recently introduced to the High Sheriff of North Yorkshire, who introduced us to some incredible charities. So we've been working alongside these charities to promote them on Harrogate Hospital Radio as well. So we promote them by making a jingle for them, what's going on in the community. We are more aware in the community than we've ever been before. So we get calls from different organisations within Harrogate asking if they could get involved in Harrogate Hospital Radio. And we've also increased our sponsorship from companies that want to sponsor our shows as well. It's been an incredible achievement. So yeah, working together with a lot more charities. We also work together with schools in Harrogate as well. So for the last 3 years, we've held a children's colouring competition, and the highest number of entries that we had one year was 450 entries from the schools. And as a prize for one of the winners, we actually invite them into the studios to present their top 20 on a Saturday morning. And it's just an incredible feeling, you know. So one school who couldn't thank us enough did a fundraising event for us and raised over £450. So yeah, leaving Hospedia, in my opinion, was a blessing in disguise. Being on 95.3 FM has opened up a whole new audience for us, but we never lose sight for the reasons why we're actually broadcasting. So if you're ever in Harrogate, please tune in to 95.3 FM. Thank you.
Thank you, Mark. So next, can we have Amanda Jordan, please?
Hi, good morning. Does hospital radio have a future? Has hospital radio had its day? If you Google hospital radio, these are some of the headlines that you might see. I'm Amanda Jordan. I'm the Chair of Trustees for Radio Wishing Well at Trafford in Manchester, and I'm here to say that yes, we do have a future. The impact of COVID and the cost of living crisis has hugely impacted charities in terms of volunteer numbers and fundraising. So to combat these challenges, our approach has been to raise the bar for our communication and engagement with our local communities. By making the impact of our work visible, we have generated an increase in volunteer numbers from those who want an opportunity to give back to their community. Our activities don't start and end with broadcasting, but include items such as regular interviews, promotion of local activities and interest events. We attend numerous outside events such as carnivals, fetes and school activities. And we regularly support work experience, Duke of Edinburgh students and NHS work internment programmes for young people with disabilities. We request collect on our wards weekly, and we have specific events for patients throughout the year, such as our Easter egg giving, free gift packs for events throughout the year, and our Christmas carols on the wards. Our community know us, they trust us, and they value us. After 42 years of Radio Wishing Well, we hope our part in promoting hospital radio will leave a legacy that keeps it alive for many generations to come. Thank you.
Thank you, Amanda. Next, can we have Kate Michelle, Winchester Hospital Radio?
Good morning, my name's Kate Michelle and I'm the recently elected chair of Chichester Hospital Radio. I have been inspired by what I've heard. Mine is a challenge, and the particular challenge that we face is that we do get some brilliant volunteer requests, absolutely marvellous. We put them through a probation period where we offer them full and professional training, and then they go to the volunteers office and are asked to fill in 462 forms, watch 982 hours of videos that Netflix would never rate. Then they're asked to go and see some complete random medical person. Sometimes are then asked to give blood. They're never given warning. I've just been invited to go and give blood at a hospital I don't even volunteer at. So we are struggling with maintaining the levels of enthusiasm. Like so many of you, we too want to bring the young people through. We want them to play their types of music to patients in the hospital who listen to their types of music. We want to give them full training. We want to encourage them. We want to develop their skills. What we can't do is do all of that and maintain it with the current way in which the volunteer health and safety system works. I know there's a reason for it. and I'm certainly not having a go at anybody who is maintaining it, but I think they need to understand that volunteers, young and old, don't always have 15 hours to watch videos, the relevance of which we are struggling to understand. I work with some amazing human beings, but at no point in time do I want them removing the oxygen of any patient in the hospital. So please don't teach them how to do it, because occasionally one of them just might. So, how are we trying to get round this? This is not a moan fest. How are we trying to get round this? We have developed a really, really good working relationship with our volunteers office, who have more challenges on their plate than enough. So we are coming to them as part of the solution and not part of the problem. We are not there yet, but those people that are here today who have perhaps not yet met me, I'm a tenacious madam and I'm not giving up. Thank you very much.
Thank you, Kate. So next, if we could have Neil Anderson from the Hospital Broadcasting Service in Glasgow.
Thanks, Nigel. Good morning. So I was asked to do one of these thought-provoking 90-second presentations, but what subject to do it on? I struggled for a couple of days, and then I was looking at this picture here.
Hang on.
That picture there. And ping! The idea came to me. That's the team who are shortlisted for the awards tonight. Well done to them and to everyone else here shortlisted. Best of luck. So, in a very unscientific piece of research, based on looking at that picture, I went off and had a look at half a dozen randomly chosen hospital radio sites on the web, looked at the programme schedules, and from that, I found that of the ones I'd randomly chosen, 2 of the stations had 1 female presenter on air across the week. 2 had 2 female presenters. 1 out of 25 presenters, 6 were female, so almost a quarter, that's great. And the 6th one, 0. You might be from a station which is well represented with a male-female balance. Brilliant if you are, well done. If you're not, then maybe it's worth asking the question, why? In Glasgow, we didn't always have around 50%, in fact slightly over 50% of our membership female. We used to just have a token number of people. We realised that could be improved, but how to improve it? We didn't go out on some massive recruiting drive saying, if you're a woman, come and join us, we want you. We looked at it from the other perspective. If somebody wants to come and join us, we need to make it more appealing or perhaps less threatening for them to come in as a volunteer. And the way that we decided to do that was for the couple of women we already had, they ended up on one particular evening, and then we directed new folk coming into that evening so that there was more support. It was going to be more comfortable, less threatening. So that's one way that we did it. There's lots of other ways. There's lots of discussion that you can have on how to include other people. Obviously, women is just an example. It could be other ethnicities, whatever it is. So with 90 seconds, I don't have time to say anything else on it, but perhaps it's planted a seed. Thank you.
Thanks, Neil. And lastly, if I could call Wesley Pritchard, Rookwood Sound, please.
Why did I choose to sit at the back? Hopefully that 10 seconds walk down doesn't come out of my 90 seconds. Good morning, everybody. My name's Wesley Pritchard, and I'm a volunteer at Rookwood Sound Radio within the Vale of Glamorgan in Cardiff. 1 year ago today, I have no experience in radio. I'm newbie. This is actually my first conference. And the reason why I say 1 year ago today, I had no experience in radio, it was something that I always wanted to, but there was never a presence. And just by an opportunity of going to visit someone in hospital on Boxing Day last year, the radio station was live on air. So I frantically banged on the window and I said, "Can I come on now?" And they were like, "Yes." So they let me come in on air. 20 minutes later, I'm still talking. And the reason why I say that is because, in my opinion, I think hospital radio stations, we shouldn't just be heard. You have to be seen. If I hadn't seen that radio station then, I wouldn't have been able to get involved with that. And 12 weeks later, Rookwood Sound offered an intensive training, one-on-one training. and now I present my own weekly show. And it was just by chance that I saw the station, and I frantically banged on the window and asked them, could I come on? And so that was a little bit about my story, but I'm going to tell you some of the challenges that we face on Rookwood. So Rookwood has made some significant changes, such as becoming a CIO, and recently started broadcasting on DAB+. That was last November, and trying to reach a much wider reach. Of course, this is the important bit which I have to write down, because as a newbie, it doesn't just come naturally. So, becoming a CIO, we recently started broadcasting on DAB+, and this was offering us a chance to appeal to a much wider audience reach and increase our funding stream by becoming a health and wellbeing radio station. Some of the other issues that we face is interaction with our patients due to poor infrastructure on the wards. And as a result of the pandemic, being able to visit this is still an issue, and accessing relevant information for broadcasting, such as public service announcements, we have to get from the Central Office of Information. So they're the struggles that we face. But the one thing that I did notice from stations is that radio stations need to have diversity. We need to have a mix of different ages, people from many different backgrounds, because I think, in my experience coming into the station, a wide variety of people offer huge insight into life, and that then translates through the radio and offers a listener a huge variety of different perspectives and music choices. And I'll finish off with saying, hopefully I haven't gone over my 90 seconds, we are proud. Did you take off the 10 seconds of walking down? So I've got 10 seconds, okay. So we are proud to present significant amounts of live shows, and as a station, we're very positive about the future. Thank you.
Thank you. So lots of inspiring talks there from representatives from across our member stations, and some themes I'm sure we'll pick up in the panel sessions in the Q&A a little bit later on this morning. But next, I'd like to welcome our first keynote speaker. We've got Steve Brine, who's the MP for Winchester and the chair of the House of Commons Health and Social Care Select Committee. With Steve's experience and insight, I'm looking forward to his talk and his take on the future of hospital health and wellbeing broadcasting in a changing NHS. Steve.
Thank you, Nigel. Hello, everyone. Thanks for inviting me. This is pretty cool for me, and I'll explain why in just a second. I think one of the first speakers said that, if you Google hospital radio, I Googled hospital radio yesterday, and when it brings up those suggested questions, the first question that came up is, does hospital radio still exist? I think there's an answer to that for Mr. Google. Look, it's really great to be here. I'm the organisers, and Anna from Winchester Radio, who I've known for many years, asked me to come along, and it wasn't an easy. I get asked to do one or two things on a Saturday morning, as you can imagine. It wasn't a difficult question to answer, and she wanted me to share some thoughts about what the select committee that I chair does, and I'll do that and try and link it into the work that you do as best I can. No reason why many of you should even know what a select committee does. Maybe I'm biased, but it is where the good work goes on in the House of Commons. It's where the good people hang out. Anyway, the other thing is, I'm really looking forward to hearing, while I'm with you this morning, some of your thoughts on how health and wider well-being, and I like the idea, hospital health and well-being broadcasting is a smart way to tag it, if I may say, to look in how else that might support broadcasting and support the volunteers that we've heard from some of this morning to support health and well-being across the sector that I'm very proud to say, which is why it is cool, I was once a member of. So Junior Choice was where it began. The Radio Lion Late Show was where it went to, and then my particular favourite was Bedtime Brine, which I used to do late night on a Thursday night, at Radio Lion at the Royal Surrey Hospital in Guildford. And this was quite a while ago, as I'm older than I look. But there was no smartphones then, and very happily, there are very few recordings. In fact, the ones that there are in my loft. So for my son who's here today, you can't reach. But unbeknown to me, my best man seemed to have access to my loft, because when I got married, to my great surprise and shock, I heard a montage of my hospital broadcasting career, broadcast to my entire friends and family across the marquee in my parents-in-law garden. And somebody mentioned jingles earlier, and boy, some of the jingles that I've made over the years, I cringe at it, but I also, it took me into a very successful, if not short, because I moved into politics when I was quite young, but career in professional broadcasting. But more importantly, I loved it. I absolutely loved it, and it gave me some of the skills and the confidence that allowed me to go on and have the career that I've been very fortunate to have in Parliament and indeed in government. And I'm actually leaving the House of Commons at the next election. But there's no question that I wouldn't be doing the things that I've done without the skills that hospital radio and broadcasting gave me. And in return, I hope I contributed a bit to the service, and the many stations represented here today maybe recognise some of the things that I'm saying, to patient care and recovery. And I used to spend a lot of time on ward visiting. I always used to, not just because I did the Junior Choice show first off, but I always used to go onto the kids' wards, as I found that in many ways the most rewarding. And then I used to go up onto the maternity wards because I didn't feel that they were as sick, and I found that was easier to talk to. When I was on the maternity ward with my wife in this hospital just around the corner here, when we had our 2 children, hospital radio came round, so that closed the loop. So I was struck by our friend from Cardiff who said that hospital radio has to be seen to be believed. In a bit way like the late Queen used to say that she had to be seen to be believed. I think that's really important, and I think it's a really interesting comment, because when at Radio Lion, we were originally at the old St Luke's Hospital in Guildford, and then when that was taken down, we were moved over to the Royal Surrey, the hospital that we know today in Guildford. But when I say we were in the hospital, I would think it'd probably be more accurate to say we were underneath the hospital. We were in the basement, and had to go down a couple of flights of stairs to find it. And I always used to make the point, and for hospitals, trusts, you do have to be seen to be believed. And I know spaces at a premium hospitals. Of course, I know that more than most. But actually, hospital radio should be there in the foyer. And maybe outside broadcasting equipment through phones and microphones makes that easier today. It wasn't easy when I was at Radio Lion. But anyway, I'm really sad to say Radio Lion's no longer with us. It was one of the casualties, one of the reduction in numbers that we've seen. But I just would like to place on record thanks to them for everything they did for me, and for the Lions Club in Guildford in Surrey that helped fund it and raise so much money to keep it going for so long. It's a place where friends were made for life. And I actually, the guy who trained me at hospital radio all those years ago, his wife is here today, who I met earlier on before we started. So that's nice. So partnerships were made for life. So I guess I've had the perspective of being both poacher and gamekeeper. As first, I was a health minister in Theresa May's government. I was the public health minister and the primary care minister. I'm currently the chair of the committee, as said by Sam, that is charged by the House of Commons with scrutinising my successors in the department. And that provides me a pretty privileged vantage point, to be honest, which I can share some insights, in particular some wisdom, I hope, provided by those generous enough to give us their time, submit evidence to the committee, and then appear before it as witnesses. It's a cross-party committee, which gives it a lot of its strength, I hope, and that we then scrutinise the policies, the performance of, yes, the ministers in the department, but also many arm's-length bodies, so the Patient Safety Commissioner, the Commission, various other organisations that we live. And they come in and they give oral evidence to us. And it's all carried live on parliament.tv. And any of you would, of course, be welcome to carry it live on your stations. Well, I'm not sure it would be exactly a great driver of your listener numbers, but amazing how many people do actually listen to it. So any of you would be interested, I suppose, to know that what we produce is inquiries from our reports, and then we produce recommendations aimed at ministers. And when I was a minister, I used to take what came from my select committee very seriously. It's actually quite easy answering questions in the House of Commons. It's really hard answering questions in front of a select committee because there's no time limit and they can come back at you again and again and again. And it's a lot easier asking the questions than answering them, I can tell you. But we produce these reports. And as we near the end of this current Parliament and another general election, the select committee is busier than ever. We could sit every day from now till dissolution and we wouldn't get through the work programme that we've got. So what have we learned about the current state of the NHS? I mean, look, the key perception now is that we are in a period of extreme pressure across the system. And, you know, and stress, I suppose, sort of interrelated clinical, administrative, economic challenges of the pandemic, they continue to play out. And our ability to maintain healthcare, welfare and well-being of the country. So it's not just the job of the health service, and it's not just the job of the government to look after the health and well-being of us all. It is the job of community and society, and you're part of that. So I'll take you through some of the inquiries that we're doing some work on at the moment. And all the rest, it's all online. You can look up for more detail if you want, and there's a lot more detail online. But the big piece of work that we're doing, and what we do when we sit down, and I took over from Jeremy Hunt as the chair of the select committee, and he phoned me up and he said, you'll never guess what she's asked me to do, she who shall not be named. And I said, go on. And he said, she's asked me to be Chancellor. Do you think I should do it? I said, yeah, I do. Bring some sanity. Anyway, so he did. And that obviously opened up the vacancy. And he said, yeah, I'll do it, but only if you run for the chair of the health committee, which I did. And then what you do is you sit down with the clerks, and you sit down with your members, and you work out all these different inquiries that you might look into, and then the chair gets his way. Joking apart, that's pretty much what happens. And the main piece of work that we're doing is on prevention. So it's on prevention of ill health and promotion of well-being. So let's start with that inquiry, and that probably goes to the heart of healthcare in the broadest sense for me. I passionately believe that the NHS in its current form is unsustainable if we don't face the prevention challenge properly. So our inquiry, what we did is we went out and we asked people for ideas as to what we should look at, and we had about 500 different ideas in the prevention space, and we had to. And I suppose what was the common thread that ran through all of them? Probably inequality was what ran through all of them. And we're then looking at each aspect of prevention because we boiled it down into 10 different work streams. And they're a bit like the Olympic rings, is the way I think of it. Is that, you know, the Olympic rings obviously stand in isolation, but what do? Well, they interlock. So you can't really talk about cancer without talking about prevention. You can't really talk about prevention without talking about obesity. So that's what this inquiry is about. And the subjects that we will focus on were identified by, as I say, by these sort of hundreds and hundreds of submissions. And we look at social, environmental, and health and well-being factors. We're looking at what a healthy place should look like, from housing, indoor air pollution, number of fast food shops, childhood, early years, alcohol, gambling, to sexual health and to mental health. And this will all come together, and we're publishing reports, interim reports on each of the work streams, and then we'll publish an overall report on prevention of ill health, which I hope will set the weather for the next government to take this agenda seriously for the reasons that I've said. And for those who say that tackling ill health through prevention. So when I was in office, I brought in the sugar tax, the soft drinks industry levy, as it's called, which gives you Coke Zero, etc. And that was very successful because it led to the industry reformulating sugary drinks. And it was criticised at the time as being part of the so-called nanny state. And somebody stood outside the Department of Health with a board calling me Nanny Brine. They did it for 2 weeks once. It was astonishing. I took him a coffee once, and I take the view that in a publicly funded health system, you not only have the right, you have the responsibility to intervene at population level public health, because ultimately it comes back on the health service. So I don't have an awful lot of truck with the nanny state argument for those reasons. And prevention has always sort of been one of my primary interests when it comes to health and care. And I think it is, as I say, it's key to the future of the NHS. The first piece of work that we did was on vaccination. Of course, the biggest intervention you can make in public health next to clean water. And we produced a piece of work on that, which has definitely shaped government policy. And then our second work stream was on healthy places, so where we live, where we work, and how our housing, for instance, impacts on our health. The original health department was called the Health and Housing Department. That was Nye Bevin's vision. And there's reasons for that, because housing is a big determinant of poor health. And so we've done all this piece of work. The latest piece of work we're doing is on alcohol, drugs, smoking, and gambling. We've only held a couple evidence sessions so far. And I said that we all have a role, and I see that 100% as involving you for the reasons that I said. You, and somebody said this in the presentations, you are the trusted voices. Maybe it was Sam said it at the start. You are the trusted voices. The local press is much more trusted, who knew, than the national press. But you are part of the local media landscape, and you are trusted voices. So not only does hospital radio have an opportunity to survive, it has an opportunity to thrive through being broadcasters beyond the hospital walls. And I know that's what Winchester Radio have done, and I know that's what many of you have done, and that's the theme that's come through in the presentations. So a couple other things that we're working on. I said about intervening in public health. Now, on Tuesday, when the House of Commons comes back on Monday after its Easter break, on Tuesday we have the tobacco and vaping bill coming before the House. It is controversial. I don't know why. Smoking is the biggest preventable killer in our country today. I didn't think there's anything particularly controversial about lung cancer. It's not a good thing. So we're going to legislate on the tobacco and vaping bill, and we're going to produce, finally, hopefully make a reality of the smoke-free generation policy that I implemented as Public Health Minister. So nobody who is 14 today will ever be able to legally buy cigarettes, and we're going to take powers around disposable vapes, and we're going to take powers around the flavours of vapes. And a credit to the Prime Minister, who's a friend of mine, who's a local boy, as Nigel said at the start. He's a Southampton fan, but you can't have everything in life. And you only have so much political space to do these things. When the Labour government brought in the smoking ban in public places, the then Public Health Minister, Caroline Flint, only had so much political space to her left. Lots of people in the Labour movement didn't want to see that happen. The working men's clubs did not want to see that happen. There was a lot of very, very powerful lobbying against that, as there is now, against this tobacco and smoking, this smoking and vaping bill. There is only so much political space the Prime Minister has to his right, for obvious, well-publicised reasons. So that's why I say credit to him for bringing this forward, because there will be people who say this is banning things. I believe a former Prime Minister's been on the media in the last few days saying that it is mad and crazy. Well, some of us think he's mad and crazy. Anyway, couple other pieces of work that we're working on. Men's health hasn't been done in the House of Commons for a long time. Nobody takes men's health seriously enough in the House of Commons. We have started a big inquiry into men's health. Worryingly, men's life expectancy fell in 2020. So that's working on figures pre-pandemic, before you think that was the outcome of that. And we've had a huge input from people on the men's health inquiry. It's produced a huge amount of interest, which I'm really excited about. Future cancer. So if you ask me what gets me out of bed, what got me out of bed as a health minister, it would be the prevention agenda, it would be the cancer agenda. When Theresa May became Prime Minister, she phoned me up and she said, I'd like you to become one of my ministers. And I said, that's fine, but I just want to be the public health minister and the cancer minister. And she said, that's very specific. Most people normally say they just want to be a minister. Anyone will do, as long as it's got a folder and a car. I said, no, I just want to be the public health minister and I want to do the cancer job. And it meant an awful lot to me. And I set in train the ambition, the policy that David Cameron had flirted with, and she announced that we would diagnose 3/4 of cancers at stage 1, stage 2. Obviously, early diagnosis is cancer's magic key. That's what Future Cancer's about, but it's about lifting its gaze from the day-to-day cancer figures. and it's about thinking about what does future detection look like? How do we upstream detect cancer at those very early stages to meet that ambition that I set? And it's about what does future cancer treatment look like? So as the population ages, 1 in 2 of us will go down this track. As the population ages, what does precision medicine look like? And specialized personalised cancer medicine, what does that look like? So the Future Cancer Inquiry will report, I hope, shortly after the Easter recess. So if you're interested in that, we had a really interesting inquiry, been to various parts of the world, including to Singapore, where the mantra, which I really like this actually, we try and find it early. If we can't find it early, sorry, let me just read it. He said this to me. We try and prevent it. If we can't prevent it, we try and find it early. And if we can't do that, we treat it effectively with minimised impact. And that's a great mantra in Future Cancer, and that will come out early in the next session. Pharmacy, doing a lot of work on pharmacy at the moment. I was the pharmacy minister as well within my primary care brief. Huge untapped potential in pharmacy around as its part in primary care. And Pharmacy First is a great innovation. It's something that I had trialled in government, and as you've seen, it's been rolled out as of earlier this year. It's got huge potential to harness that part of primary care, so we're looking forward to that. And the only other things that we're doing, just because that's not enough, we're doing a big piece of work on NHS dentistry, we're doing a big piece of work on assisted dying and assisted suicide, which you'll be interested in the work. And before Sam pushes me off the stage, let me just say this to you. We are... I'm your keynote speaker. We are, as always, inspired by the army of volunteers that works alongside the staff in the NHS. That is also true, of course, in your world. I'd be really interested during the time that I'm with you today to hear more about your discussions on how you might ground future-proof, I guess, hospital health and wellbeing broadcasting in this evolving NHS. I know it's difficult. I know resources are challenged. Maybe I'm biased, but the team at Winchester Radio, I think, are a really good example of how you do it. I listen to it all the time. I was listening to Tony this morning, driving in, and then he was here. The magic of radio. So, the online offering obviously reaches out in the literal sense. But the weekly Winchester Now podcast that they do here is a really great way to reach out. I've been on it myself many times. It's a model, I think, of population-level social prescribing. And I really do think all of these different parts of the NHS that I talk about, primary care, about pharmacy, in being seen, being believed, being heard, being believed, the broadcasting that you do, and Winchester stayed true to its principles as a hospital radio station, but it's obviously now, like so many of you, a community radio station. That's the future. That's how you stay relevant. That's how, when you Google hospital radio, it doesn't come up with that question anymore. So that's what we do on the Select Committee. That's why I love this sector, and it's given me an awful lot, and I really appreciate you indulging me, even on the red light. Thanks.
Thank you, Steve. Okay, so can we please welcome and put our hands together then for our next keynote speaker, Julie Dawes, Chief Nurse of Hampshire Hospitals NHS Foundation Trust.
Can you hear me all right? Yes, all right. Thank you. It's always great following Steve. So my name's Julie Dawes. I'm Chief Nurse at Hampshire Hospitals. Can you hear me all right? Thank you. And I'm actually here for Alex Whitfield today, who's my Chief Executive, who is in Malaysia visiting her daughter. And before she went, she said, there's a couple of things you need to do for me, Julie, while I'm away. There's a little event on Saturday morning, if you could cover that for me. So here I am, and I will do my best to give you a bit of an oversight of what it feels like to be in a hospital. I think there's quite a good connection with some of the messages we've heard this morning about the promotion of health inequalities, prevention, and the role that we play, but obviously how I've tried to link it to the role of hospital radio and broadcasting to that agenda. And for me, as a nurse, I will always try and bring it back and relate it back to the patients, which is why we're all here. So these are some of the things that I'll just try and cover this morning, as I've said. So let's go, first of all, really importantly, how things are changing for us. So, and this is definitely how it feels like in the hospital. We've got a large rise in the elderly population. 1 in 6 of us will be over 60 by 2030. And in Hampshire particularly, we're seeing a really large rise there. So 30% of the population will be over 75 in 10 years' time. That really matters for how hospitals work, how healthcare is provided, and actually, as Steve said, how we need to change in response to that. Many of our patients now, particularly in that age group, have multiple comorbidities. So it is not uncommon for many of our patients to have diabetes, to have cancer, to have cardiovascular disease. And that makes it really, really complex to be able to manage all that. And from the patient's point of view, it means they are in many systems at any one time. And I think the landscape, particularly for some of our elderly population, is really hard to navigate their way through with multiple kind of hands-off and hands-off. And one of our big challenges is how we make sure that we wrap that around the patient and that they're not having to try and navigate their way through a very complex system. 1 in 6 of people who are over 80 will have dementia. And again, that matters. The way we provide, the way we prepare for our hospitals in the future to be able to look after patients with dementia is another key challenge for us. And then we have seen a really big increase in people who are suffering from mental illness and the impacts of autism and learning disability. And that's in both adults and children. And it is particularly risen as a result of COVID, and as we're now starting to see the impact of the lockdown and isolation. We always used to talk about the waves of COVID, and we always knew that there would be a wave of mental illness that would follow that. And we are definitely seeing that. And the way that kind of plays out in the hospitals in particular is, some really, really complex young people who are in crisis, and there isn't the capacity out in the community to be able to transfer those patients in a timely way. And what that means is many of them end up staying in a hospital setting for longer than we would like. And those environments are not suitable for them, both from a safety point of view or for a therapeutic and experience point of view. So again, a lot of work that we're doing at the moment to try and make sure we get those pathways right. Steve mentioned earlier on, when we look at how we create a healthier population, we traditionally have tended to look at health and increasing what we do to care and treat for people. But if we're really to try and understand and improve the population's health, we do need to look at all those determinants of health. And as Steve said earlier on, many of these sit in our communities. So education and training, the housing, the social the social environment that people live in, these are all really strong determinants. And as a broadcast, as radio broadcasting, both in hospital or in your provider services in the community, this is what, I think you've got a really big role to play in kind of bringing some of this awareness, helping promote what is out there for people, and helping us kind of improve that population health. One of the ways, I think it was Sam who talked about ICBs, so we're constantly restructuring the health service, aren't we? We'll have to do that. I think I saw a slide a little while ago, it said we've been 260 restructures in about 20 years. The most recent one is the creation of integrated care boards and integrated care systems. We have services that are provided through providers, so mental health, acute hospitals, and then we have what used to be the clinical commissioning groups, which have now kind of formed into integrated care systems and integrated care boards. And I was lucky enough to be seconded to be the chief nurse in our local Hampshire and Isle of Wight integrated care board to help set it up. And I actually am a really strong believer of what this can do, because it's a vehicle that allows us to work as a system across health and social care in particular. And the barriers between the care pathway are becoming more and more blurred. So it's really, really important that we do that. And this is something that's come out actually of one of the national policies, so I'm sure Steve will recognise this. This thing called Core 20+5. I don't know how many of you are aware of this, but this is being designed essentially as a vehicle for systems, so in our case it's Hampshire and the Isle of Wight, to look at the needs of the population. So in order to increase and improve the well-being of people, it suggests that, as well as the things we do every day, that we target those that are at most risk. And what we do know is that 20% of our population across the country fall into some of the most deprived areas, so the deprivation index that's applied to that. And we know that if you are in a deprived category, your chances of living well and living longer are more limited. So one of the core bit of that is concentrate our targeted prevention at the core 20% of the country. The plus part of it is that we also know that there are, and we'll come on to talk about it, areas of exclusion and isolation. So there are populations that, on top of that, need to be understood and targeted for their health needs. So that may be people with mental illness, learning disability, and others. And then the 5 is areas where we think there are key clinical areas of health inequalities. So along the bottom you'll see there, starting right at birth. So for maternity care, as an example, what we know is if you are a mother pregnant and you are from a Black, Asian or minority ethnic group, the outcomes for yourself and your baby are worse. But we also know that actually there is really strong evidence that if you have a continuity of care model of midwifery care, so this is where you have a small number of midwives who look after you from the moment you get pregnant, through your antenatal care, through your delivery and postnatal care, actually you've got a better outcome for you and your baby. So all of us across the country are putting in what we call continuity of carer teams to be able to address that. Similarly, chronic respiratory disease, early cancer diagnosis, as Steve mentioned earlier on, so making sure we target the picking up of the cancer really early in order to have the opportunity for an intervention. Hypertension, so we know that we can do a lot to prevent cardiovascular disease if we pick it up. So a simple blood pressure check that, you know, if it's high, you get signposted and directed to healthcare to be able to do that. Doing all these really do make a difference. And then on the end then, smoking cessation. Smoking is one of the areas that has got the biggest impact, and in fact it impacts all those 5. So core 20 plus 5 is a really big part of the Hampshire and Isle of Wight, but everywhere will have a core 20 plus 5 plan. So, you know, I would really encourage you to go and have a look at in your areas that you work, what that means for you, and what do you think some of those messages could be that you could, can kind of promote. This is a bit of a busy slide, but again, every one of the areas you work will have one of these, which is an inclusion health group. So this is for Hampshire and Isle of Wight, but it is quite important because each population will have its own kind of local inclusion areas. So essentially, inclusion is a kind of catch-all term for those people that are socially isolated for one reason or another. So the very specifics here for Hampshire and the Isle of Wight, for example, is we've got a prison. That brings us a particular, lots of areas will have prisons, but that gives us a particular health and care need that we need to prepare for and manage. We actually, I was just meeting my colleagues in Winchester prison, which is literally over the road, just recently, and one of their issues is the rising population within prisons. So 20, 30 years ago, it would be a younger generation. Now they're having to cope with prisons that are not designed for people in wheelchairs who are disabled. Gypsy, Roma and Travelist communities. So we know within these communities that they often don't access care in the same way. Their education and training levels are less. And again, that impacts on them. So we have to think differently about how we provide care to be able to access some of the communities there. People with drug and alcohol dependency. So we're seeing a really, really, really large increase in alcoholic liver disease, particularly as a result of alcohol. And it's not always It's not always your most common presentation. So, middle-aged women who have an alcohol problem, who, drink quietly at home, for example. We've got if you've got a naval base on your area, that often has a large alcohol problem associated with it. People experiencing homelessness, and again, and many of these kind of cross over. You can be homeless and have a problem with alcohol and drug dependency. Coastal communities, we've got quite a few, and people often think of coastal communities as communities with, lots of people choosing to retire, which is true, and it makes it an elderly population, but they are often some of our most deprived areas as well. Veterans, this is a particular one for us, and veterans, each generation of veterans have different issues, but veterans, will often present with, they've obviously, particularly if they've been in active war, they've got many physical things we need to think about, but also things like PTSD, etc., which we need to take care of. I won't go through them all, but you can just get a picture, can't you, that actually within the communities there are quite a lot of very specific needs that you might want to hear about and learn about, and just think about how you can support that. So let's just move on then to some of so this is a kind of future state hospital. We are, in all parts of the country, there will be a kind of new hospital building programme. We've got in England a hospital building programme we hope will be 40 new hospitals, and Winchester and Basingstoke are one of these areas, Hampshire hospitals, who we're hoping will have a new hospital. This is a real opportunity for us, and the hospital building programme is very much designed to build all the hospitals in a standardised way, so less opportunity than there's been in the past for an individual design, but more a standardised design based on best evidence, best practice. And a really, really big part of that is to digitally enable the hospital provision, both the care and the kind of way we manage the hospital. Part of the programme is looking at the moment about whether there is a suggestion that the hospital should be all made up of all side rooms, so 100% side rooms, and certainly the experience we had in COVID would suggest we definitely did have a really big issue there. However, particularly just thinking about yourselves, what that does mean if we were to have that is, I think a higher degree of isolation for patients, particularly elderly patients who will find themselves possibly for long periods of time. So as anything, as you address one problem, you potentially, create yourself another. But that is something that we're kind of tackling with at the moment. So many of you have talked about hospital as part of the community, and I really, really believe that. Actually, I heard this statistic a few weeks ago, and it really struck me. I hadn't clocked it, but 1 in 50 members of the working population work in the NHS in some way. So, we talk about the population, but actually our staff themselves are a big opportunity for us to think about in terms of that, back to that health promotion, but also they're great communicators. They all, for those that work with us, they will have their families living in the area. And you see that, I can go around our hospital. I went last week to our neonatal unit, had 2 nurses retiring. They'd both been there in that unit for 35 years. They're an absolute, the hospital is a big part of their lives. We are seeing an increasingly diverse workforce in the hospital. So at Hampshire hospitals, we have staff from over 80 countries working with us now, which is amazing. It's brilliant, and that diversity brings a fantastic opportunity for us to learn. Again, I think there was a little bit of a challenge. I think it was from Warren about how diverse, or I would say, looking at, I manage our volunteers, some of our voluntary workforce, etc. So trying to make sure that we've got equal access for everybody to join our voluntary services is something really important. The other bit here, I just wanted, we know that the hospital plays a really big part in people's lives. So, it follows them through from birth to death. Many of us, our most important times in our life, when we're at our most vulnerable, or when our families are at the most vulnerable, are spent in these settings. And that's why it's so important for us to remember that, because the local hospitals or the local healthcare services are such a big part of the community. And I sometimes think we could do a lot more at kind of embracing that, really. And I think we've got something to learn from you for that as well. And then the last thing, and I think somebody mentioned earlier on about the opportunity, well, in fact, Steve himself mentioned about his volunteer role earlier on. We often have people doing work experience with them. I see them move through then into, they'll go away, do their undergraduate, come back, training, come back to us as a trained member of staff. They will leave, they'll retire and become part of our voluntary workforce. And at the moment, I think it kind of happens, but we could actually embrace that. When I used to work in a mental health unit, one of the things that is really common for people with mental illness is that they find it really difficult to maintain work. And so we had a programme that allowed people to get work experience, volunteer, then get paid work experience, and ultimately help them get into work, back into work. The changing role of care. So I have seen so many changes, and just a few. So what you'll see, particularly in hospitals, you'll see the length of stay getting less and less, more and more people treated in the community. When I first did my nurse training, if you had a baby, you'd be in for 2 weeks. You're lucky if you're in for a day now. Hip operations, going home within 24 hours. A really, really fast turnover. But then equally, a lot more patients who are elderly, complex, staying for longer. So that change in profile. Virtual wards, I think you'll all have virtual wards. That is going to grow and get bigger. So thinking about how we care for people in their own homes, but with the oversight of the hospital. Robotic surgery, and we will increasingly see artificial intelligence starting to play a role, and particularly genetics as well. We've talked about many of the benefits to patients, and in a way it's obvious, but I would just like to pick up a couple actually here. So the first one is the loneliness. I don't think we pay enough attention to loneliness, particularly as we're getting older, and we know for a fact that if people lose a partner, that has a real impact on their health. Many people die within 2 years of losing a partner if they've been married over 50 years. So you have a really, really important role to play there. Probably that, let's not just underestimate that really important entertainment and distraction, which if for any of you been in hospital, it's a very long day, it's a very long night, and actually having something to do about that. And my last point, I'm sorry, I know I'm running up, but I promise I'll be literally a few seconds. I just wanted to bring it right back to the patient, because this is what we're all here for, isn't it, ultimately? And I just want to say a really big thank you, and you make a difference. You make a difference to our patients every day. I've been a nurse for 43 years. I've seen lots of technology, lots of change in treatments, etc. But there are some things that don't change. Being needing to be helped with feeding, being able to help with basic care, and actually being able to sit and be in contact with people, and that's where you come in. It's a fundamental part of a need of a person receiving care, and you have a really important part to play with that. Thank you.
Thank you. Please give a big hand for Julie Dawes. May I just take the opportunity as well to thank Steve and Julie for giving up their Saturday morning to come and chat with us this morning. Thank you both. So we're going to take a quick refreshment break now, 11:15. The trade show and demo room are now open as well, upstairs and to the right in the two studios. So go and grab yourself some refreshments. We'll reconvene here at 11:40, so if you can be in here a few minutes before. We'll start our panel sessions with our keynote speakers and those of you that were involved in the showcase presentations as well this morning. If you want to come and join in those, we'll see you shortly. Thank you very much. Okay, well, good afternoon, everyone, or good morning. I think it's still just about morning. Hopefully you found those panel sessions, those keynote sessions inspiring and engaging, and there was a lot of useful information in them and some common themes that certainly I picked up. My first question, I'm going to ask a couple of questions this morning, and then we'll open up the floor so that you can ask questions to either our keynote speaker or any of those that did the short 90-second showcase sessions. So my first question, Julie, is for you, really, and it's how do you envisage, you talked about health inequalities in the NHS and the evolution of the NHS and how it's about health and social care is now changing to support people and tackle prevention and things like that. How do you see hospital health and wellbeing radio fitting in to the NHS as it is today?
Thank you. So I think what we are. Can you hear me all right? Yeah? Okay. Oh, I think so the problem we've got at the moment is that the care we provide is dealing with the health of the people which have lived a certain life or had a certain circumstance. So we'll always have to continue, but with the health promotion and health prevention, hopefully in time to come, the people who will come through and need access to our care will be different. I think one of the things that we're seeing that's really different is quite a different generational attitude to healthcare. So generalisation, but the more elderly tend to be more compliant, more engaged in, what a professional will tell them to do. Younger generations are wanting to take much more of a bigger proactive part in have informed consent and have decisions over their care. So I think linking that back to you, your hospital broadcasting, embracing that and helping us for those who want that information to be able to provide them with that information, or signposting. Increasingly, we are working as a system. So the voluntary third sector, actually knowing what's out there, for example, there's one of the problems we often have is that people just don't know what's out there and available to them. So actually being able to support that, I think, would be a really good way forward.
And I suppose my follow-on question from that, Julie, and I think one of our 90-second showcase presenters touched on it before, is about raising that awareness within the NHS of hospital health and wellbeing radio. And we're finding at my station, Radio Horton in Banbury, that many of the staff, since we've returned to ward visiting last year, many of the staff are now familiar with our volunteers. We've become familiar faces on the wards. Do you think it's really important that hospital radio does more to try and engage within their NHS trusts?
Yes, I do, and I was just talking to Anna actually and saying there are loads of opportunities, and you come to an event like this and it kind of triggers it, doesn't it? But things like we take a staff story, or a patient story to our board, our senior management team. So you will all your organisations will do that in some way or other. So I think don't be forgiving. Just go and speak to your chief exec and ask for that kind of platform and that audience. I actually do think it's really good to be visible. I think you get recognised, you'll be used more. But and things like, for example, we've got a hospital Facebook, for example. There's lots of different mediums now that you could use to be really visible. So just don't be frightened of going to your executive team and saying, I'd like an audience with you, I'd like to talk to you, because you will get a positive reception. I'm sure of it.
Thank you very much. And Steve, my first question to you, I suppose, is... No worries. My first question to you, I suppose, is what more can be done in government level to put hospital health and wellbeing broadcasting on the map?
Sorry I was late. I think that was number 10 was just calling and picked up on... Picked up on. Sorry, the previous number 10 was calling. Look, I said we have to get away from the principle that what are they going to do about it? Because who is they? Because hospital radio is a good example of we getting on and doing something for ourselves. It's not. There is a limit. I'm sorry to break anybody's delusions, and I don't think anybody here would have them, but some do. There is a limit to what the state can do, and there is a limit to what the state should do. Now, there are things that the state gets in your way on, and you heard that earlier, one of our speakers about regs. So there are things like that we can get out of the way, but what you've got to do, surely as an organisation, is exactly what you are doing, which is to rebrand yourself as health and wellbeing, hospital broadcasting, community broadcasting, because you have to go and meet your audience where they are. In my world, in politics, I don't expect people. The reason why when I leave here I'm going canvassing, because it's the local elections. I can't wait to retire. The reason why I'm going canvassing is because I'm going to meet the voters where they are. I don't expect them to come to me. You're by doing what you're doing and Julie talked about this earlier, these virtual wards, which sounds a bit of an odd thing, odd concept, doesn't it? But it's actually a real thing. And increasingly, we want people out of the acute settings to be cared for at home, to be cared for in community settings. And so while hospital broadcasting was obviously established to talk to people in the acute settings, inside the hospital walls, that isn't where the vast majority, clearly, of your potential audience is. So, you know, touch wood, at the moment, I'm not inside a hospital setting, but I listen to Winchester radio in the car because it's on DAB, and I listen to the podcast on my phone. So, you know, I love the way that you're going out and finding your audience and meeting your audience where they are. That's exactly what you can do, but there is a limit to what government can do. Truth.
Okay, so I'm going to open up the floor now for questions to either our keynote speakers or to our showcase 90-second presenters. Any questions? Silence.
A quiet hospital radio audience.
Oh, we've got one. In the middle. Who's got the roving mic? Nigel? Middle, black t-shirt.
Thank you. Probably a question for Steve and that. You say hospital radio is very much part of the local media. Obviously, funding is probably one of the main difficulties that we have as an organisation. But should hospital radio be afforded the same as community radio, where Ofcom has a community fund? And I'd say if we are part of this local media, should hospital radio be afforded the same?
Yes, 100%. I chair the Health Committee, but I also sit on the DCMS, the Digital Culture, Media and Sports Select Committee, and we are the scrutiny body of Ofcom. And as you deliberately blur the line between hospital broadcasting and community broadcasting, we have to then revisit those regulations, and you make a very good point. I would implore you to write to your MP and copy to me, and I will see that the chair of said committee gets it, who's also a Hampshire MP, actually, Caroline Dinage, because you've made a very good point and just sparked a good thought for me. My next campaign. Thank you.
Okay, who have we got next?
Hi, my name's Sarah from Gosport Hospital Radio. So my question is probably to about your comment actually about that it is everybody's responsibility, which I completely agree with, to be honest. It isn't just a government responsibility, a state responsibility, it's everybody's responsibility. I also work for a government department, before I just say that, but I also, I'm secretary for the hospital radio, which I've got involved with recently, and have been involved in charities for a very long time. And some of the challenges and the cost that is attached to, for a lot of charities now, is, and you're going to your point, Kate, about volunteers, the legislation, regulation, etc. now is really costing charities a lot of money, and that is digging into their frontline costs now as well. At the same time, there's other legislation as well, things like GDPR, etc., and Charity Commission rules, etc. What would be really helpful is if, and I know this doesn't always happen, so government departments could be far more joined up than they are, to look at these different challenges that the charity sector are now providing. And the charity sector, over the years, with various cuts, have picked up an awful lot of the statutory responsibilities of various governments over the years. So what would be helpful is if that area could be really looked at where it overlaps and there's duplication, to cut that down and make it much easier for charities to do the job and do it well for people in the community and help improve people's lives.
Do you want to take that, Steve?
Only just briefly to say, we don't just throw this show together, as they say. It's perfect that you should be the next speaker, right? Because you're the Gosport, and the Gosport MP is Caroline Dinage, who chairs said select committee. So I will tell Caroline that you will be in touch and to respond promptly and quickly when I see her on Monday. And please copy it to me, and I will see that she meets you. And if I can join that, I would invite myself to do so, because it would be great. But it's a perfect setting for her committee to look at. Perfect setting.
And I think that's something that's actually quite, you've touched on a really good point there. I know we've had issues within my station in the past where we've tried to recruit volunteers, and the red tape within the NHS has actually been a barrier to them coming on board because they don't want to spend several hours doing all the statutory and mandatory training that they're given. They just want to come to the studio for a couple of hours a week and present a radio programme. So I think there is definitely some work to be done in that space. Where have we got next?
Hi.
Okay, hello.
Hi, my name is Gabrielle and I'm from Basildon Hospital. The question I have, I think this would probably go to you, Sam, or anyone on the board, is just about training for presenters. So for those of us who do the ward request shows, speaking to some other presenters, I've noticed that in some hospitals, their training seems to be at a higher level when it comes to how to interact with patients, for example, those with dementia or things like that. But for some other ones of us, we don't really get that. So it's kind of like, how can the HBA make sure that all the presenters are consistently trained in that regard? Because we know what to do in regards to the technical stuff, but when it's what impact we're having on the people, how can we be consistent with that?
That's a really important question, Gabrielle, and thank you for bringing that one to our attention. It's something that we haven't really focused on within HBA. What I would say is we have got we are in the process of developing a training platform, which will be part of our new website. And on that training platform, there will be space to put advice, guidance, support, and training materials up there for prospective volunteers regarding how to do things like that for ward visiting and interacting with patients. I know within my hospital, we've got one really proactive ward volunteer, and she is brilliant. She will go up to anybody and spend ages and ages just chatting to them, telling them about the hospital radio service, and she's just got the ability to be able to connect and engage with people. So we've actually got her training up other volunteers to go and do ward visiting rounds as they come in. So I think it's about as well as HBA doing something at national level, perhaps at station level, if you've got someone who's a really good advocate for speaking to patients, speaking to staff, use them as a bit of a training instructor, if you like, to get them to demonstrate to your other volunteers what can be done, because the work that ward volunteers do is absolutely fantastic. I speak on behalf of all of us in the room. There isn't any other radio service quite like hospital radio. Most people that work in the commercial sector of radio rarely get the opportunity to go out and meet their listeners. So we've got that really unique opportunity to go out and engage and speak to patients and tell them about what we do. There's still something quite nice, I think, about hearing your name mentioned on the radio. I think a lot of people like that when they, and the fact that the volunteer has taken the time to go and speak to the patient and introduce themselves, and they've put the name to the face and made that connection. It's just really important to highlight the work they do. So thank you, Gabrielle. Yeah, of course.
I just wanted to add to that as well, because I was just talking to Gabrielle outside, and I think there's also opportunity for us to be networking a lot more as stations. Each of us are out there on our own, doing our own little things, and we'll have our areas of expertise. And actually, rather than each of us reinventing the wheel each time, if we do a lot more collaboration, a lot more sharing, that will ease the burden for all of us as well. So I think things like training, we already do the shared programming, but training could be another thing where, if you've got someone who's a really good advocate or you've got really good processes and systems in place, let's share that amongst each other and help each other out.
Thank you very much. Perhaps one for, I don't know if Emma's in the room. Emma? Yep. Emma, who's our Zoom social coordinator. We hold those sessions every month. They're basically informal, networked get-togethers, usually around a specific topic or theme. So perhaps one for us to focus on, Emma, is ward visiting. Next question.
My name's Jerry Brown. I'm the new chair of Mid-Downs Radio in Haywards Heath. And I was interested hearing what Kate said, and also some of the comments that I've been hearing from other people about the fundamental challenges that hospital radio appears to have, primarily in terms of some of the, if you like, some of the politics that are going on within trusts. I don't know if there's a standard or a set of standards that we should expect to be able to follow, to be able to communicate with people, and I recognize it's probably on a trust-by-trust basis. But my own experience is, having just joined this particular group, is that it's really hard to get any kind of commitment, any kind of consensus, and I'm not surprised that people are saying hospital radio is dying, on how best we can serve our main constituents, which are the hospitals. And I wanted to find out if other people are having the same challenges and what they're doing to resolve it.
Anyone like to take that one? Yeah, Jason? Oh, you've got a mic.
So it's really interesting you say that, because one of the things that we touched on in the video for CHBN earlier was the work that we're doing with our communications team. Now, probably about a year ago, I went and had a meeting with the communications team, and basically, I felt that we were being underutilised, and that I think we had a lot more potential to be doing a lot more to support the patients and support staff. So went along to this meeting with a load of different suggestions about things that we could do. And much to my surprise, they came up with a suggestion that was far better than any ones that I had written down, and that was that they wanted to do, and with our support, put together a weekly programme, both targeting the patients and the staff. But of course, they had really great access to a lot of the staff, both at all different levels across the trust, and it's been a phenomenal success. So probably my one single bit of advice would be, if you haven't already, go and make friends with your communications department, because actually, as a result of that, we've got exec members that are now in our studio on a regular basis. We've got Pete, the person that heads the programme, is actually working on how to get us out and available more in the public areas and waiting areas. So it's been really, really useful to have them on board as an advocate, if that helps towards the question at all.
I think as chair of Harrogate Hospital Radio, I think it's really important that you've got to build up a relationship with the trust, and we are very fortunate that we have a great relationship with HHCC, which is the community charity based in Harrogate, and they actually, everything that we do and they do, they communicate back to the trustees, and they actually come to the studios, they get involved with us. Any outdoor events that we are involved in, they're involved in, they actively come to us and tell us. I think it's all about building your relationship and the trust that you've got with the trust as well, and they can see the good work that you're doing, because they get the feedback from the patients and the staff, so they know it's a valuable service that we're actually providing. I highly recommend that you get to know the trust staff. It's really important.
Thank you for the question, Richard, and I'm really glad I know what you look like. We belong to the same trust, and I think one of the things that would be beneficial is if all of our sister stations got together and put our heads together and said, what do we do well, what can we learn from, what are we duplicating, and how can we get out and about? So prepare to be stalked.
Right, who have we got next?
Hello, I'm Steve King from Radio Frimley Park. Kate, I think most of us in our station were much taken with your comments about voluntary services, although I think we have 4 or 5 less forms than you do, which is obviously good in Surrey. But I wonder what that being part of the solution rather than being part of the problem actually might look like in practice. And opening that up a little bit, somebody else was talking about diversity and particularly gender, and I can see that's a problem certainly in our or a challenge in our station in particular. And I wonder what we do to make the station more attractive to not just ladies, but gender in general, ability, ethnicity. I mean, all of that diversity field really. Interested in the panel's comments.
Quickly come in on the first bit. The whole idea about being this part of the solution and not at all part of the problem, first of all, just developing relationships. So I'm practically our volunteer office manager's best friend. We try to give them positive input. We've offered things like, if it helps, would you like us to produce the videos? Because, you know, we've got some experience in this regard, and maybe one of our presenters would be slightly more interesting than the chap from IT. So, you know, we're offering to make it, and we're also offering justifications and explanations. I'm not in here moaning about the videos. I'm in here saying I am losing volunteers hand over fist because they're having to work out how to do horizontal patient evacuation. Trust me, if there's a fire, get out. I don't want to push a bed, just run and get out of the way. So the relationship side of it, I think, is incredibly important. And just go to them and say to them, we can offer you lots and lots of positive support. We've offered to put promos out for them. So when they think of us, they don't think of, oh, hospital radio, come to moan again. They think, oh, actually, I wonder if they could help with this. And that's how far I've got to date. But I have more that my new best friend doesn't know about yet.
Neil, did you want to answer the second part?
Yeah, I'll actually just touch on the first part first and then go into the second part, because we've been there. So about 10 years ago, NHS Greater Glasgow and Clyde, which is not a trust as such for those south of Hadrian's Wall, but a government administrative organisation. It's bigger than the biggest of the trusts in England. It's a bit of a behemoth, and they wanted to bring in a service level agreement, so we ended up with about a 60-page document as a proposal. Lots of commercial information in there because it was based on their standard procurement SLAs that they've got. So we probably spent a year or so back and forward digging our feet in and saying, that ain't going to work for us. We're not going to be sending people in to do a one-day fire training course and get them to blast different types of extinguishers, which all your staff are doing. Doesn't make any sense. We pared the whole thing down to the point where we now run our own 1.5-hour session. We've got various NHS documents which we share with all the new volunteers. They've got a few forms that they've got to sign, including an interesting one which was asked for by the NHS team, which was basically along the lines of, I'm in perfectly good health. If I fall over and die on the ward, it's my problem, not yours. So, you know, it gives them a bit of indemnity. So I think that just pushing back on some of these crazy ideas that they've got on, you've got to come and watch these videos and spend this time, we can't do it. We're volunteers. So just standing your ground and hopefully the sensibility will come out at the end of the day. So that answers that one. On the gender thing, as I said at the end, yeah, I was just looking at the picture and it could be male, female, but from that same picture that we showed, it could be a youth versus more aged, and I'll put myself perhaps into that bracket, although I'd like not to. But yeah, and I think I mentioned ethnicity. Our presenter last night was someone from India. One of our volunteers who's in for the awards tonight, who's in that picture, is Hungarian. So we've got you know, various people from various backgrounds and a fairly good range of ages, and a lot of that is down to just preparing the ground to make it more appealing when people come in. So in terms of how we opened up more for women, it was that they wouldn't be on their own and with a bunch of tech geeks who just like to talk Ohm's law or whatever it is, or wow, isn't that an amazing crossfade I did from one item to the other, it was like bang on the beat, isn't that fantastic? That's not what most people are hopefully coming to hospital radio for. It's communication with the patient, helping them. I think there was a phrase that was used on one of the slides earlier, which was about distraction like a pod. So we quite often use the phrase positive distraction. That's what we're here for, to hopefully, where you've got someone going into an unusual environment of a hospital ward, or in the case of the new hospital in Glasgow, almost 1,000 rooms, all individual rooms, so exactly isolation, exactly that. So going into an unusual environment and switching on a radio that sounds like a radio station that they would hear if they were tuning in at home, and is something that they can relate to. So it's all about relatability and being able to hook people in, and then on that platform, delivering all those messages about services that are available, what we can do, what other organisations are out there to do to help people. So hopefully that kind of answers the question. It's about building the platform to build.
I am just going to have to interject, Neil, sorry, because we're running short on time. Julie, did you want to say something quickly?
Well, just one comment. In terms of increasing diversity in your volunteers, every one of your organisations will have an EDI lead, and I'd suggest you really go and find that person out, because they will have lots of contacts and lots of ideas for you about how you may, do some positive role modelling, encourage people to join you, and they will have networks already set up. So just one action there, and I think would make a big difference.
And then do we have one more question from John? Is that correct?
Hi, John O'Donnell from Air Hospital Radio, and this is directed to Mark Oldfield from Harrogate. You'd said earlier that you moved from Hospidio onto FM. Had you thought about doing DAB? Is that next in your...
Yes, thank you, John. We had an opportunity not long ago, really. Ofcom, as you may be aware, put applications out for certain areas, and they've gone in stages. And Harrogate were recently awarded a licence for Harrogate and Wetherby, and a company, a local radio station actually in Harrogate applied for it and actually won the licence. And because we were a charity, and obviously they were aware of all the work that we actually do within the community, we were invited to be on their DAB platform, the multiplex platform, free of charge, obviously because we were a charity. You still have to pay the DAB licence fee to Ofcom, we understand that. However, they actually had their licence revoked because they couldn't afford to go on the multiplex system because the cost had escalated so far, up to £25,000, they just couldn't actually do it. However, when I was approached by another radio station in Harrogate, they were also going to be given a platform on the multiplex, but they had to pay for it. Now, this company called Tempo FM in Harrogate have actually applied directly to Ofcom to see if they could take over the licence, and Ofcom have welcomed them up and said, please apply for it. So if they get it, they are actually offering us a platform to go on DAB, as I said, free of charge because we're a charity. So if whatever area you're actually based in, wherever you are in this room, I would highly recommend that if you've got a communications officer to download Ofcom's newsletters, because you get all the information from that, and it may come to your area. But then approach whoever applies for the licence, that you're a charity, and they might offer you the same platform as well. But that is the next stage that we actually plan to go to in Harrogate.
Thank you, Mark. Right, I'm going to have to wrap that up there because we've got 10 minutes until the AGM. We've overran slightly, but thank you to our panellists. Please give them a round of applause. And thank you again to Julie and to Steve for giving up their mornings. If you could please remain seated unless you are going to register for the AGM, that would be much appreciated because we're going to start promptly in about 8 minutes' time.